Welcome to Part 1 of the Blindness Basics for Employers. This brief presentation is for employers who are interested in gaining foundational knowledge about blindness and low vision. Whether you are interested in hiring someone with blindness or low vision, or you just want to learn more about the topic, you are in the right place. In Part 1, you will discover how prevalent visual impairments are, what is considered normal vision, how vision is measured, and the parts of the eye. Visual impairment, including blindness and low vision, is a low-incidence disability. According to 2018 statistics from the American Community Survey, or ACS, an estimated 2.3% of non-institutionalized people of all races, ages, ethnicities, and education levels in the United States reported a visual disability. The measurement of how clearly one sees is called visual acuity. Visual acuity, or normal vision, is described as 20/20 vision. Saying 20/20 means that a person can see at 20 feet what the average person can see at 20 feet. What does this mean for a person with less than normal vision? Let's say, for example, a person has a visual acuity of 20/30. Saying 20/30 means that this person sees with the same clarity at 20 feet what the typical person sees at 30 feet, indicating lower visual acuity or less clear vision. The standard tool for measuring distance vision is the Snellen chart pictured on this slide. Typically, the chart consists of 11 rows of letters. The top line has one huge letter. The letters in all subsequent lines increase in number and decrease in size. The smallest line on most Snellen charts represents 20/15 vision, which is better than normal vision. Young children or adults who do not know the alphabet can be tested using a chart with pictures, shapes, or a series of E's turned in different positions. The other way to measure vision is through visual field testing. The visual field is the area a person can see when their gaze is fixed on a central point. There are different visual field tests. The most common test involves a doctor directing the patient to fix their gaze at a specific location and holding up different numbers of fingers at various points. The patient's job is to tell their doctor how many fingers he or she is holding up without moving their gaze. More accurate tests involves the use of instruments in which lights or images are presented at different points, and the patient identify whether they saw something to the left or right by pressing a button. The typical field of vision is approximately 180 degrees. This will be represented by a full, clear image on this slide. Common visual field deficits include a loss of peripheral or side vision, which is the first image on the slide, half the visual field, the second image on the slide, or central vision called a scotoma or blind spot. Low vision refers to a vision impairment that is not correctable through surgery, pharmaceuticals, glasses, or contact lenses. While no standard exists for the definition of low vision, many agencies consider 20/70 to be the threshold for receiving services due to vision loss. Note that acuity levels are usually based on how well a person sees in the better eye with the use of corrective lenses. Visual field loss may also place an individual in this low vision category. The pictures on this slide illustrates how two people can have low vision but see the same images differently. The first image is completely blurry, while the second image is blurry everywhere except at the central point. In most federal or state statutes, legal blindness is defined as a vision of 20/200 in the eye with the best vision, with the best correction, and/or having a visual field that encompasses an angle of 20 degrees or less. The first part of this definition describes how clearly one can see, acuity, and the second part of the definition references how much area of the potential visual field one sees. If either component of this definition is met, the person is legally blind. When an individual cannot see anything except the largest print on the eye chart, but their vision can be corrected with glasses or contacts, they are not legally blind. Similarly, if someone's vision in one eye is better than 20/200 with or without correction, the term legal blindness cannot be used to describe their level of vision. Contrary to public perceptions, most people who are legally blind have some remaining useful vision and use it in a variety of ways to accomplish everyday tasks. The chance that two legally blind individuals function in precisely the same way is unlikely. Remember, two different measures exist to meet the definition of legal blindness. Example, reduced acuity or clarity and reduced field of view. Additionally, the definition of legal blindness only marks a threshold. Once an individual has met the definition, they may continue to lose vision. Individuals who are totally blind are also legally blind. How does the eye see? The human eye is like a film camera. The eyelids are like the camera's lens cap. The cornea, which is the clear front covering of the eye, is the camera's lens. The pupil is like the aperture of the camera. It changes size to control the amount of light entering the eye. The lens is like the film of a camera. It changes shape to sharply focus light directly on the retina, where it is converted into electrical signals that are sent to the brain via an optic nerve. The brain interprets this signal as something a person understands as a dog, tree, wall clock, TV, newsprint, etc. Any imperfection or interruption to the visual pathway will likely cause the vision to be impaired. To learn more about the visual system and how different eye conditions affect the eye, check out some of our free short courses, such as Basics of Blindness and Low Vision, an overview of anatomy and physiology of the eye, and How to Read an Eye Report. You have reached the end of Blindness Basics for Employers Part 1. We hope this brief presentation has provided you a basic understanding of what normal vision is, how vision is measured, and how the eye works. Proceed to Blindness Basics for Employers Part 2 to learn how to courteously interact with individuals with vision loss, strategies and access technologies used by individuals with blindness or low vision. For those who are interested in learning about hiring an individual with blindness or low vision, please see our short videos, Inquiring Minds, Should I Hire an Applicant That is Blind? For more information, please contact the NRTC at Mississippi State University. The NRTC's phone number is 662-325-2001, or we can be found on the web at blind.msstate.edu or intac.blind.msstate.edu.